Picture a moment when healthcare systems face immense pressure, and tough decisions must be made about who receives life-saving treatments or vital resources. Ethically rationing scarce healthcare resources means making these difficult allocation choices transparently and consistently, guided by established moral principles to ensure fairness and maximize overall benefit. At its core, this challenge requires balancing fundamental bioethical principles. The principle of justice demands fair distribution, treating similar cases similarly, and often considering factors like medical need or potential for benefit. Beneficence compels us to act in the best interest of patients, while non-maleficence guides us to avoid harm. However, when resources are truly scarce, upholding all these principles perfectly for every individual becomes impossible, creating deep ethical dilemmas. Some frameworks aim to maximize health outcomes for the greatest number of people, while others prioritize equal access or focus on the most vulnerable groups. So how do we navigate this complex landscape? First, a robust ethical framework is essential, established through broad societal input, not just by a few individuals or a small committee. This framework should clearly define the values and goals guiding allocation. Second, transparency is paramount. This means ensuring that the criteria for allocating resources are clear, publicly understood, and consistently applied to every situation. Third, involving diverse stakeholders is crucial. This includes medical professionals, ethicists, policymakers, and especially community representatives, which helps build trust and legitimacy for the difficult decisions being made. Fourth, decisions often prioritize medical necessity and the likelihood of successful treatment, aiming to maximize health benefits while also considering a patient's overall prognosis. Finally, these policies must be regularly reviewed and adaptable, learning from experience, incorporating new medical advancements, and evolving societal values to ensure they remain just and effective over time. It is crucial to distinguish between explicit rationing, where policies openly state who gets what and why, and implicit rationing, which occurs through less obvious means like long wait times, limited access to specialists, or restricted prescription coverage, all without clear, publicly understood reasons. While confronting explicit rationing can be uncomfortable, openly discussing and implementing it fosters greater accountability and public understanding. This transparency is a key component of ethical governance in health, preventing hidden disparities. Often, in emergencies or mass casualty events, a structured triage system is used, prioritizing those with the greatest chance of survival with medical intervention, ensuring that limited resources achieve the best possible outcomes in critical moments. By grounding our decisions in shared ethical principles, striving for transparency, involving the community, and continuously refining our approaches, we can work towards a healthcare system that manages scarcity not just effectively, but also with profound respect for human dignity and fairness. It is a continuous, community-wide commitment to difficult but necessary choices.